Hi guys, it's Vicki. I look a lot different, I know. I have just gotten home from being at Perfect 10 Beauty Bar and I got a treatment done underneath my eyes. It looks crazy, doesn't it? It kind of looks like henna, but it isn't. I'm going to explain to you a little bit about what I had. I have some pictures that we took during the procedure. I also have a little bit of video. So let me go over first what I had done, and then I'm going to tell you a little bit about it. And I'm going to be looking over here because I have my computer right here with all the notes. And so what I had done was, it's called Fibroblast under eye treatment. And it says Fibroblast is an absolute new revolutionary procedure which requires zero surgery. It is non-surgical, non-invasive treatment that is designed to tighten and lift the skin. It shrinks excess skin, crow's feet, bags, and wrinkles. Well, don't we all want that? I had my eyebrows done by Logan about a week ago, and I trust her. I know the facility. I trust them. And I had been thinking about having this procedure done since I had read about it and heard about it on YouTube. And so I had talked to Logan about it. I definitely want to say at the beginning of this, don't do anything just because I did it. You know, make sure that you contact or talk to your doctor about it if you have any health issues. I'm going to read what all this information has about this fibroblast, this plasma treatment that I had done. So how long does plasma skin tightening last? 2 to 4 years. That's what they say. I think in some cases it will be less. It kind of will depend on your skin, but they are saying it could last 2 to 4 years if you are a candidate that does what they tell you to. You probably have a good skincare system already in place. It says plasma pen skin tightening results are permanent. However, the face, neck, and body, of course, will continue to age. So I'm moving my computer up. What is plasma fibroblast therapy? This therapy targets fibroblasts. These are collagen and protein producing cells in the skin, the dermis, and it is the skin just below the outermost skin layer. Plasma fibroblast therapy uses a pen-like device that discharges a high-frequency electric current to small areas of the skin. The plasma tip didn't really touch my skin. It just releases, it says it releases a current just above the skin, and this hot current creates small holes or micro injuries in the skin's layers. So I'm going to pull you up. Can you see that it is ... and see my smile lines? See how she went in the smile lines? I have a really puffy place right here. She ensured that she got around that. There's a real puffy bag right there. And I'll talk to you a little bit about how it feels in just a minute. This plasma fibroblast therapy, that's hard to say, breaks down proteins in the skin. It encourages your tissue to regenerate. It stimulates activity in your skin, and it causes tissue contraction or tightening. Don't we all want our skin tightened, especially as we get older? And I'm 60. I mean, I wanted tightening underneath my eyes. So it says, what are the benefits? It can treat the following conditions. It can treat acne scars, aging, age spots, wrinkled skin, including around the eyelids, the neck, the jawline, above the lips. It says, if this therapy is performed in a safe, controlled environment, it can improve your skin texture. It can offer mild to moderate skin tightening effects, and it can result in some degree of skin facial contour changes. So what is the procedure like? I'm going to read what it says, and then I'm going to tell you what it's like. It says they cleanse the skin. They put some kind of a numbing cream. You have to wait. Then they treat the designated skin area with the pen. This pen will make microcurrents, and it's going to make little dots, which you can see. These little dots will turn into small scab-like dots on the skin. And then the procedure usually takes 30 to 60 minutes to perform. So when I went in, I made sure my skin was clean. I wore no makeup. She put numbing cream all under here, all under there. And I sat for, I think, 45 minutes. So then we go into the treatment room. She removed all the numbing cream. She tested in a couple of places to make sure that I was numb. And then we got started. So recovery. I know everybody is going, oh my God, what in the heck is the recovery? Oh, but before I talk about recovery, I want to tell you what it felt like. It wasn't so much pain because you're numbed, but but you hear it. So you hear it sizzling every time, it gets close to the skin and she's doing that microcurrent. You can hear it sizzling. I'm not going to make the sound because I would look like an idiot. But you can hear it sizzling, and then also you can see smoke sometimes. Like when she got up here, underneath my eyes right here, she would tell me to look up. She would go under, and when she did, I could see the smoke, a little bit of smoke going up, and I could smell it. So to me, that was kind of the weirdest part, or maybe not painful part, but that was kind of the strangest part of the whole process. But of course, the whole time we're talking, I'm very comfortable with Logan. She's great. She's fun. And did I get anxious beforehand? Yes, I did. Did I get really nervous when we were about to start? Yes. But once she got going and I could tell that it wasn't going to be anything that I couldn't stand, then I was fine. You can expect small dots to scab over. They're going to fall off in about a week. Over the next couple of weeks, as your skin heals, it should appear tighter and firmer. Some people are going to see great benefits from just one treatment, and then some people may need more than one treatment. I just don't know yet. Who's a good candidate for this procedure? It just talks about if you have an allergy to any kind of topical preparations you wouldn't want to. Breastfeeding, pregnant, no. Do you have any infections on your face? No. I think people that have keloids or any kind of really bad scarring, hypertrophic scarring on their face probably wouldn't be good candidates. Let's see, are there any side effects? So the side effects are going to be redness, which we can already see. I'm already getting red. So it's been 4 hours. It's going to swell. So Logan told me probably tomorrow, the second and the third day, the swelling will probably be those will be the worst days. You're going to see light spots, some dark spots. The skin could peel and crust in places. So then it talks about cost. I'm not going to tell you what this cost me. I'm just going to say that, if you're interested in doing this, you need to talk to your healthcare provider. Then you need to find somebody that's really great at this, a specialist. If you're interested, you could contact Logan at Perfect 10 Beauty Bar. I will put her name and telephone number in the comments so you can see that. It does say Celebrity Skincare Spa in Arizona is charging $500 to treat forehead lines, $400 to treat crow's feet. So that kind of gives you some kind of an idea. Last key takeaways is this fibroblast therapy is a newer technique, but even though it's new, they feel like it is a technique that can tighten your skin without the need for invasive cosmetic procedures. So I'm going to here add videos of Logan doing the procedure and of Logan talking a little bit about what results she has seen in some of her patients and what the aftercare will be like. Thank you, Logan, so much. I have been wanting to do this and I have been so nervous about it. Thank you for taking this time and doing this with me. Okay, guys, so I am here at Perfect 10 Beauty Bar. I had to take my mask off for a little bit. She has lined the area that we're going to treat, and I believe she has gone to get the numbing cream. Perfect. Okay, so this is our aftercare, right?
Yes,
aftercare.
This is aftercare. So I'm sending you home with a bar of Dove soap, and what we're going to do morning and nighttime is wash the area. You don't want to be too harsh or scrub or anything too aggressive. So what you'll do is just grab your Dove soap, lather it up on your hands, and just kind of pat the area. I don't want any of those flakes to come off prematurely, so you're very, very gentle.
Okay.
And try and use don't use any hot water. And then I'm also sending you home with some colloidal silver spray and some colloidal silver gel, and these are going to be done 3 times a day. So in the morning do it after you wash, in the middle of the day, and then at nighttime after you wash too. And what this is just a homeopathic healing remedy. It's awesome for burns, for cuts. It's been around for a really, really long time. So
you spray and then put the cream?
Spray, just mist it on about a foot or 2 away, let that dry, and then you're going to put this on with clean hands or a Q-tip, and you'll see a little bit goes a long way. One little scoop is going to go over the entire under eye area. So this should be plenty to last you.
Excellent.
And I'm also sending you home with some regenerating cream. So you'll do this after all of your flakes go away. Do it probably morning and nighttime, along with doing your SPF 2 to 3 times a day as well, so that your skin will hopefully in about 5-6 weeks will look completely normal again. Nice, tight, vibrant.
No makeup?
No makeup.
Until all the flakes?
Other than our aftercare.
Okay,
Until
gotcha.
all your flakes go away. Yep.
Oh, people, no makeup. Is that it?
Normal. Yes, ma'am.
Thank you, Logan. So we're going to take our numbing cream off, and then, so what is this procedure? So you said it's
a small plasma pen, and whenever it gets the perfect distance away from your skin, it's going to click on and make this small plasmic spark. And what that's doing is almost cauterizing that skin and also shrinking and tightening it as well. So you'll see a lot of little tiny dots all over your face. It's basically like controlled damage on your skin. Force new collagen to start building as well. And also the most important part and the most amazing part is actually eliminating that excess skin. So what we'll be doing is going around each wrinkle to help minimize the depth of that wrinkle by eliminating the skin around the wrinkle. I always kind of compare it to a carpet burn as well. It's like the first day, it's going to be nice and bright and pink. Maybe a little bit later today, whenever that numbing starts to wear off, it'll feel kind of stinging and burning, kind of like a sunburn. And then probably tomorrow it's going to start, all of your flakes will start to get a little bit redder and redder and darker until it creates that thicker, dark red crust, and then that crust is going to flake off. Typically about day 6 or 7. And after all your flakes go away, like I said, that's when you're incorporating your sunscreen, your regenerating cream. I always tell my clients wait at least 6 to 8 weeks to fully judge, but by then most of that redness and those little indentions should be gone. Cool.
All right, let's get started. This is just gonna cleanse it.
I'm gonna do just a few, and you let me know what you feel.
Tiny bit. It smells. So I did want to share this with you, and I wanted to show you actually what it looked like. Logan said for me to expect to swell tonight. I have this. I don't know if you can see. This is a ice pack that I use on my eyes, and it is going to be about perfect. So I'm going to lay that on my eyes to keep from swelling. And if you enjoyed this video and you like these kind of videos, please give me a thumbs up and please subscribe. I'm still getting started, and I still need subscribers. So subscribe and hit the little bell, notification bell. And if you click on all, you'll be notified of all my new videos. And today is day 1. So starting tomorrow, I will take pictures every day in the same place, sitting in this chair in the same light, and I will let you see as I heal what it looks like, and I will show you the before and after pictures that we have taken. So I think that's it. I'm so excited. It's tingling a little bit. I'm going to get my Tylenol. I'm going to put my eye mask on. I'm going to lay down on the couch. And the other thing is, she said we got to sleep setting up. That's part of the whole eyebrow routine also. So we're going to sleep propped up a little bit. I will see you in my next video. Be looking for the video where I show you each day's healing. Thank you so much, everybody. I have a blast doing these videos. Thank you for joining me. Please subscribe, and I'll see you in my next video. Hugs from me to you. Looks crazy, doesn't it? Bye.